A client with severe pancreatitis suddenly develops bluish discoloration around the umbilicus and flank areas. Which physiological complication does this finding most strongly indicate? A. Severe intraperitoneal hemorrhage with pancreatic enzyme leakage. B. Acute hepatic necrosis caused by biliary obstruction. C. Portal hypertension due to pancreatic edema. D. Systemic allergic reaction to digestive enzymes. Answer A. Bluish discoloration around the umbilicus, Cullen's sign, and flank areas, Gray-Turner's sign, indicates retroperitoneal or intraperitoneal bleeding. In severe pancreatitis, pancreatic enzymes such as trypsin and elastase digest surrounding tissues and blood vessels, leading to hemorrhage within the abdominal cavity. This bleeding tracks through facial planes to the skin, producing these characteristic discolorations. These findings signal a severe complication of pancreatitis and often indicate significant tissue necrosis and vascular damage requiring urgent medical management. A nurse caring for a client with increased intracranial pressure, ICP, notices the client suddenly develops widening pulse pressure, bradycardia, and irregular respirations. What physiological response is occurring? A. Neurogenic shock due to spinal cord injury. B. Cushing's triad resulting from brainstem compression. C. Early septic shock with systemic vasodilation. D. Autonomic dysreflexia from spinal cord stimulation. Answer B. Cushing's triad is a classic sign of severe increased intracranial pressure and impending brain herniation. It includes hypertension with widening pulse pressure, bradycardia, and irregular respirations. As intracranial pressure rises, cerebral perfusion decreases, triggering sympathetic activation that raises blood pressure to maintain cerebral blood flow. Baroreceptors then cause reflex bradycardia. Irregular respirations occur when pressure affects the brainstem respiratory centers. This triad indicates a critical neurological emergency requiring immediate intervention. A client with chronic kidney disease develops Kussmaul respirations. What is the primary physiological purpose of this breathing pattern? A. To increase oxygen delivery to damaged renal tissue. B. To compensate for metabolic acidosis by eliminating carbon dioxide. C. To stimulate renal bicarbonate production. D. To decrease pulmonary vascular resistance. Answer B. Kussmaul respirations are deep, rapid breathing patterns that occur in severe metabolic acidosis. In chronic kidney disease, the kidneys lose the ability to excrete hydrogen ions and regenerate bicarbonate, leading to acid accumulation in the bloodstream. The respiratory system compensates by increasing ventilation to remove carbon dioxide, which reduces carbonic acid in the blood and helps partially correct the pH imbalance. This respiratory compensation is an important physiological adaptation aimed at maintaining acid-base homeostasis. A trauma patient develops sudden shortness of breath, hypotension, and distended neck veins after a penetrating chest injury. Breath sounds are absent on one side. Which complication is most likely occurring? A. Pulmonary embolism. B. Hemothorax. C. Tension pneumothorax. D. Cardiac tamponade. Answer C. Tension pneumothorax occurs when air enters the pleural space but cannot escape, creating increasing pressure within the thoracic cavity. This pressure collapses the affected lung and shifts mediastinal structures, compressing the heart and major vessels. The result is decreased venous return, hypotension, distended neck veins, and severe respiratory distress. Absent breath sounds on the affected side further support the diagnosis. Immediate needle decompression is required to relieve pressure and restore cardiopulmonary function. A client with syndrome of inappropriate antidiuretic hormone secretion, SIAD, presents with confusion and seizures. Which electrolyte imbalance is primarily responsible for these neurological symptoms? A. Hyperkalemia. B. Hypernatremia. C. Hyponatremia. D. Hypercalcemia. Answer C. SIAD causes excessive release of antidiuretic hormone, ADH, which promotes water reabsorption in the kidneys. This results in dilution of sodium in the bloodstream, leading to hyponatremia. When sodium levels drop significantly, water shifts into brain cells due to osmotic gradients, causing cerebral edema. The resulting swelling increases intracranial pressure and disrupts neuronal function, leading to confusion, seizures, and potentially coma. Rapid recognition and correction of sodium imbalance are critical to prevent permanent neurological damage. A patient with severe burns develops decreased urine output despite adequate fluid replacement. Which physiological mechanism most likely explains this change? A. Increased renal perfusion pressure. B. Acute tubular necrosis from prolonged hypoperfusion. C. Enhanced glomerular filtration due to catecholamine release. D. Decreased antidiuretic hormone secretion. Answer, B. Severe burns can lead to massive fluid shifts, systemic inflammation, and decreased circulating blood volume. Prolonged hypoperfusion of the kidneys may result in acute tubular necrosis (ATN), a form of intrinsic renal failure characterized by damage to renal tubular cells. These damaged cells impair filtration and urine production, resulting in oliguria. Even after fluid resuscitation, renal function may remain compromised until tubular cells regenerate. A client experiencing a severe allergic reaction develops airway swelling, hypotension, and tachycardia. Which mediator is primarily responsible for these physiological effects? A. Histamine. B. Insulin. C. Aldosterone. D. Dopamine. Answer, A. During anaphylaxis, mast cells and basophils release histamine in response to an allergen. Histamine causes vasodilation, increased capillary permeability, and bronchoconstriction. These effects result in airway edema, decreased blood pressure due to fluid leakage into tissues, and compensatory tachycardia. Histamine release is a central mechanism in the pathophysiology of anaphylactic reactions. A client with liver cirrhosis develops ascites. What physiological process primarily contributes to the formation of this fluid accumulation? A. Increased plasma oncotic pressure. B. Portal hypertension and decreased albumin production. C. Increased renal sodium excretion. D. Decreased lymphatic drainage from the liver. Answer, B. Ascites in liver cirrhosis occurs due to multiple mechanisms. Portal hypertension increases hydrostatic pressure within the portal venous system, pushing fluid out of blood vessels into the abdominal cavity. At the same time, damaged liver cells produce less albumin, lowering plasma oncotic pressure and reducing the ability of blood vessels to retain fluid. These combined factors lead to accumulation of fluid within the peritoneal cavity. A nurse assesses a client with diabetic ketoacidosis who has fruity breath and rapid respirations. Which metabolic process is primarily responsible for this presentation? A. Increased glycolysis. B. Excess ketone body production from fat metabolism. C. Decreased gluconeogenesis. D. Increased insulin secretion. Answer, B. In diabetic ketoacidosis, DKA, insulin deficiency prevents glucose from entering cells for energy. As a result, the body begins breaking down fatty acids for fuel through a process called lipolysis. This leads to production of ketone bodies such as acetone, acetoacetate, and beta-hydroxybutyrate. These acidic compounds accumulate in the bloodstream, causing metabolic acidosis. Acetone is exhaled through the lungs, producing the characteristic fruity breath odor, while rapid respirations help remove carbon dioxide to compensate for acidosis. A client with spinal cord injury above T6 suddenly develops severe hypertension, headache, and flushing. What physiological condition is occurring? A. Hypovolemic shock. B. Autonomic dysreflexia. C. Neurogenic shock. D. Acute adrenal crisis. Answer, B. Autonomic dysreflexia occurs in individuals with spinal cord injuries above the T6 level. Noxious stimuli below the injury, such as bladder distension or bowel impaction, trigger massive sympathetic discharge. Because inhibitory signals from the brain cannot pass through the injured spinal cord, uncontrolled vasoconstriction occurs, causing severe hypertension. The body attempts to compensate with reflex bradycardia and vasodilation above the level of injury, leading to symptoms such as headache, flushing, and sweating. A patient with heart failure develops pulmonary edema. Which physiological mechanism most directly causes fluid accumulation in the lungs? A. Increased pulmonary capillary hydrostatic pressure. B. Decreased alveolar oxygen concentration. C. Reduced lymphatic drainage in the lungs. D. Increased surfactant production. Answer A. In left-sided heart failure, the left ventricle cannot effectively pump blood forward into systemic circulation. This leads to blood backing up into the pulmonary veins and capillaries. The increased hydrostatic pressure within these vessels forces fluid out of the capillaries into the alveolar spaces. As fluid accumulates, gas exchange becomes impaired, leading to dyspnea, crackles, and hypoxia. Pulmonary edema is therefore primarily driven by increased hydrostatic pressure in pulmonary circulation. A client receiving blood transfusion suddenly develops fever, chills, and flank pain. What physiological mechanism is responsible for this reaction? A. Immune-mediated destruction of transfused red blood cells. B. Dehydration from excessive fluid administration. C. Platelet aggregation causing microvascular occlusion. D. Release of insulin causing hypoglycemia. Answer A. An acute hemolytic transfusion reaction occurs when the recipient's immune system attacks incompatible donor red blood cells. Antibodies bind to antigens on the transfused RBCs, triggering complement activation and rapid destruction of these cells. Hemoglobin released into the bloodstream can damage the kidneys and cause symptoms such as fever, chills, hypotension, flank pain, and hemoglobinuria. Immediate discontinuation of the transfusion is necessary. A patient with Addison's disease develops severe hypotension and hyponatremia during an acute illness. Which hormonal deficiency is primarily responsible? A. Cortisol and aldosterone deficiency. B. Excess thyroid hormone. C. Decreased parathyroid hormone. D. Increased insulin secretion. Answer A. Addison's disease involves primary adrenal insufficiency, where the adrenal cortex fails to produce adequate cortisol and aldosterone. Cortisol is essential for stress response and maintaining blood pressure, while aldosterone regulates sodium and water retention in the kidneys. Deficiency of aldosterone leads to sodium loss, dehydration, and hypotension. During stress or illness, the body cannot mount an adequate hormonal response, leading to an Addisonian crisis characterized by severe hypotension and electrolyte imbalance. A nurse notes a client with sepsis has warm flushed skin, hypotension, and tachycardia. Which physiological mechanism best explains these findings? A. Systemic vasoconstriction caused by catecholamines. B. Widespread vasodilation from inflammatory mediators. C. Increased cardiac output from fluid overload. D. Decreased capillary permeability. Answer B. In early septic shock, inflammatory mediators such as cytokines and nitric oxide cause widespread vasodilation. This leads to decreased systemic vascular resistance and hypotension. Increased capillary permeability allows fluid to leak into tissues, reducing circulating volume. Despite hypotension, the skin may appear warm and flushed because of increased blood flow to peripheral tissues. Tachycardia develops as a compensatory response to maintain cardiac output. A client with hypocalcemia exhibits muscle spasms and positive Chvostek's sign. What physiological process explains these neuromuscular symptoms? A. Increased threshold for nerve activation. B. Enhanced neuronal excitability due to low calcium levels. C. Suppression of acetylcholine release. D. Decreased muscle membrane permeability. Answer B. Calcium plays a crucial role in stabilizing nerve membranes. When calcium levels drop, sodium channels become more easily activated, making nerves more excitable. This increased neuronal excitability leads to spontaneous nerve firing and muscle contractions. Clinical manifestations include muscle spasms, tetany, and positive Chvostek's and Trousseau's signs. Severe hypocalcemia can also cause seizures and cardiac arrhythmias. A patient with acute respiratory distress syndrome, ARDS, has severe hypoxemia despite oxygen therapy. What is the primary cause of impaired oxygenation? A. Destruction of alveolar macrophages. B. Increased surfactant production. C. Alveolar collapse and fluid accumulation. D. Increased hemoglobin affinity for oxygen. Answer C. ARDS results from widespread inflammation and damage to the alveolar capillary membrane. This damage allows fluid and proteins to leak into the alveoli, causing pulmonary edema and collapse of air sacs. Surfactant production is reduced, further promoting alveolar collapse. These changes severely impair gas exchange because oxygen cannot easily diffuse through fluid-filled alveoli. As a result, even high concentrations of supplemental oxygen may not correct hypoxemia. A client with severe dehydration develops tachycardia and decreased blood pressure. Which physiological mechanism initially helps maintain circulation? A. Activation of the renin-angiotensin-aldosterone system. B. Increased insulin secretion. C. Decreased sympathetic nervous system activity. D. Increased renal sodium excretion. Answer A. Dehydration reduces circulating blood volume and blood pressure. In response, the kidneys release renin, initiating the renin-angiotensin-aldosterone system, RAS. Angiotensin II causes vasoconstriction, increasing blood pressure, while aldosterone promotes sodium and water retention in the kidneys. These actions help restore circulating volume and maintain perfusion to vital organs. A patient with myasthenia gravis experiences worsening muscle weakness at the end of the day. What physiological defect causes this condition? A. Destruction of motor neurons in the spinal cord. B. Autoimmune blockade of acetylcholine receptors. C. Excess acetylcholine release at neuromuscular junctions. D. Decreased calcium release in muscle cells. Answer B. Myasthenia gravis is an autoimmune disorder in which antibodies attack acetylcholine receptors at the neuromuscular junction. With fewer functional receptors, acetylcholine released from motor neurons cannot effectively stimulate muscle contraction. This results in muscle weakness that worsens with repeated use because available acetylcholine becomes depleted. Rest temporarily improves symptoms as neurotransmitter levels recover. A client with hyperthyroidism develops heat intolerance and weight loss despite increased appetite. Which physiological mechanism explains these findings? A. Decreased metabolic rate. B. Reduced mitochondrial activity. C. Increased basal metabolic rate from excess thyroid hormones. D. Decreased sympathetic nervous system activity. Answer C. Thyroid hormones, particularly thyroxine T4 and triiodothyronine T3, increase the body's basal metabolic rate by stimulating cellular metabolism and mitochondrial activity. This leads to increased energy expenditure and heat production. As metabolism accelerates, the body burns more calories, resulting in weight loss even if appetite increases. Heat intolerance occurs because the body generates excessive heat during metabolic processes. A client with massive blood loss begins to experience confusion and decreased urine output. Which physiological priority is the body attempting to preserve? A. Skin perfusion. B. Gastrointestinal circulation. C. Cerebral and coronary blood flow. D. Peripheral muscle oxygenation. Answer C. During severe blood loss, the body activates compensatory mechanisms to maintain perfusion to vital organs. The sympathetic nervous system causes vasoconstriction in less critical areas such as the skin, gastrointestinal tract, and muscles. This shunting of blood helps preserve circulation to the brain and heart, which are essential for survival. Decreased urine output occurs because renal perfusion is reduced as blood is redirected toward these vital organs. A client with a traumatic brain injury suddenly develops fixed dilated pupils on one side along with decreasing level of consciousness. Which physiological complication is most likely occurring? A. Diffuse axonal injury causing neuronal disconnection. B. Epidural hematoma causing unilateral brain herniation. C. Increased cerebrospinal fluid production. D. Hypoglycemia affecting brain metabolism. Answer B. A fixed dilated pupil on one side often indicates compression of the third cranial nerve due to increased intracranial pressure and brain herniation. In epidural hematoma, arterial bleeding between the skull and dura mater rapidly increases pressure within the cranial vault. This pressure pushes brain tissue toward the brainstem, compressing cranial nerves and vital centers. The third cranial nerve controls pupil constriction, so compression causes dilation on the affected side. This neurological finding is a critical emergency that requires immediate surgical intervention to prevent brainstem damage and death. A client with severe metabolic alkalosis begins to experience muscle twitching and tingling sensations. What physiological mechanism explains these symptoms? A. Increased ionized calcium levels in the blood. B. Decreased ionized calcium due to increased protein binding. C. Increased potassium levels stimulating nerve conduction. D. Decreased magnesium causing nerve paralysis. Answer, B. In metabolic alkalosis, the blood pH rises due to excess bicarbonate or loss of hydrogen ions. As pH increases, calcium binds more strongly to albumin in the bloodstream. This reduces the amount of free ionized calcium available for neuromuscular function. Low ionized calcium increases nerve excitability, leading to symptoms such as muscle twitching, tingling, and tetany. Even when total calcium levels appear normal, reduced ionized calcium can cause significant neuromuscular symptoms. A client with severe sepsis begins to show signs of multiple organ dysfunction syndrome, MODS. What pathophysiological process most directly contributes to this progression? A. Localized inflammatory response confined to the infection site. B. Systemic inflammatory response causing microvascular damage. C. Increased red blood cell production. D. Excess insulin release from pancreatic cells. Answer, B. Multiple organ dysfunction syndrome develops when the body's systemic inflammatory response to infection becomes widespread and uncontrolled. In sepsis, inflammatory mediators damage the vascular endothelium, leading to increased capillary permeability, microvascular thrombosis, and impaired oxygen delivery to tissues. These changes disrupt cellular metabolism and organ function. As more organs lose their ability to maintain normal physiological activity, MODS develops, often affecting the lungs, kidneys, liver, and cardiovascular system. A patient with chronic obstructive pulmonary disease, COPD, develops polycythemia over time. Which physiological adaptation explains this condition? A. Bone marrow suppression from chronic hypoxia. B. Increased erythropoietin production due to low oxygen levels. C. Increased destruction of red blood cells. D. Reduced iron absorption in the intestine. Answer, B. Chronic hypoxia in conditions such as COPD stimulates the kidneys to release erythropoietin, a hormone that promotes red blood cell production in the bone marrow. The body increases red blood cell count in an attempt to improve oxygen transport to tissues. This condition, known as secondary polycythemia, is an adaptive response to prolonged low oxygen levels. While it helps increase oxygen carrying capacity, excessive red blood cells can also increase blood viscosity and raise the risk of thrombosis. A client with acute kidney injury develops hyperkalemia. What physiological effect does elevated potassium have on cardiac cells? A. Increased myocardial excitability leading to tachyarrhythmias. B. Decreased resting membrane potential causing impaired conduction. C. Increased calcium entry into cardiac muscle. D. Enhanced sodium pump activity. Answer, B. Potassium plays a critical role in maintaining the resting membrane potential of cardiac cells. When potassium levels in the blood become elevated, the difference between intracellular and extracellular potassium decreases. This reduces the resting membrane potential and makes cardiac cells less responsive to electrical stimulation. As a result, conduction slows, leading to dangerous arrhythmias such as heart block, ventricular fibrillation, or cardiac arrest. Hyperkalemia is therefore a life-threatening complication requiring rapid treatment. A client with severe head trauma develops diabetes insipidus characterized by excessive urination and intense thirst. What physiological abnormality causes this condition? A. Excess insulin secretion from the pancreas. B. Deficiency of antidiuretic hormone from the posterior pituitary. C. Increased aldosterone production. D. Reduced sodium filtration in the kidneys. Answer, B. Diabetes insipidus occurs when there is a deficiency of antidiuretic hormone, ADH, or when the kidneys fail to respond to it. In cases of head trauma, damage to the hypothalamus or posterior pituitary can impair ADH production or release. Without ADH, the kidneys cannot reabsorb water effectively in the collecting ducts, resulting in large volumes of dilute urine. This leads to dehydration, excessive thirst, and electrolyte imbalance if not treated promptly. A client with severe asthma experiences prolonged expiratory phase and air trapping in the lungs. Which physiological change primarily causes this problem? A. Destruction of alveolar walls. B. Bronchial smooth muscle constriction and airway inflammation. C. Decreased pulmonary capillary blood flow. D. Increased surfactant secretion. Answer, B. In asthma, exposure to triggers leads to inflammation of the airways and contraction of bronchial smooth muscles. This narrows the airway lumen and increases resistance to airflow, particularly during expiration. Because air cannot exit the lungs efficiently, it becomes trapped within the alveoli, leading to hyperinflation and prolonged expiration. Mucus production further obstructs airflow. These physiological changes impair ventilation and can result in hypoxia if severe. A client with severe liver failure develops hepatic encephalopathy. Which substance accumulation is primarily responsible for neurological dysfunction? A. Bilirubin. B. Ammonia. C. Glucose. D. Sodium. Answer, B. In liver failure, the liver loses its ability to detoxify harmful substances produced during metabolism. Ammonia, a byproduct of protein metabolism, normally converts to urea in the liver for excretion. When liver function declines, ammonia accumulates in the bloodstream and crosses the blood-brain barrier. Elevated ammonia disrupts neurotransmitter balance and cerebral metabolism, leading to confusion, altered consciousness, and eventually coma. This condition is known as hepatic encephalopathy. A patient with severe hemorrhage begins to develop lactic acidosis. What physiological process leads to increased lactate production? A. Increased oxygen delivery to tissues. B. Anaerobic metabolism due to inadequate tissue perfusion. C. Enhanced aerobic respiration in mitochondria. D. Increased insulin secretion promoting glucose uptake. Answer, B. During severe hemorrhage, reduced circulating blood volume decreases oxygen delivery to tissues. Cells are forced to switch from aerobic metabolism to anaerobic metabolism in order to produce energy. Anaerobic metabolism generates lactate as a byproduct. As lactate accumulates in the bloodstream, metabolic acidosis develops. Lactic acidosis is therefore an indicator of poor tissue perfusion and cellular hypoxia, commonly seen in shock states. A client with increased intracranial pressure is positioned with the head elevated at 30 degrees. What physiological benefit does this intervention provide? A. Increased cerebrospinal fluid production. B. Enhanced venous drainage from the brain. C. Reduced oxygen delivery to cerebral tissues. D. Increased arterial pressure within the brain. Answer, B. Elevating the head of the bed to approximately 30 degrees promotes venous drainage from the cerebral circulation through the jugular veins. Improved venous outflow reduces blood volume within the cranial vault, helping lower intracranial pressure. This positioning also helps prevent obstruction of venous return that could occur with excessive neck flexion or rotation. Maintaining adequate cerebral perfusion while minimizing intracranial pressure is a key goal in managing patients with neurological injury.